picture.
This is a pelvic ultrasound of a young female with the history of primary infertility for the last 16 years. This is the uterus in front of you in longitudinal section. Well, this is the cervix, and this is the anterior myometrium. A bit I'm magnifying it to get the full view of the uterus and then to align it with the vagina. This is the full view of the uterus, and this is the anterior myometrium, posterior myometrium. This is the endometrial canal appearing central and clear. This is the urinary bladder, and this is the longitudinal section. Now, when I move the probe a bit inferiorly, I see a solid echogenic area protruding posteriorly inferiorly from the posterior wall of the myometrium, which is now this is the transverse section. This is more clear view. This is the uterus, the fundus. This is the endometrial canal. This is the focally fibroid extending, subserosal fibroid extending from the posterior wall of the myometrium, anterior myometrium, measuring approximately 40 into 34 millimeter, with multiple small calculi. These echogenic areas giving posterior shadow are in fact tiny calculi, small calculi within this relatively hypoechoic solid area, because no posterior wall acoustic enhancement is seen, and this is consistent with a fibroid, whereas this is the ovary in which we can see a follicle developing, measuring 11.2. Now this is the follicle in fact. So the left ovary is normal, otherwise the endometrial canal is normal. The cervix is okay, and in transverse section we see a solid echogenic area. This is the transverse section of the uterus with normal ovary, and this is the longitudinal section, where you can again make up that this is the endometrial canal, this area. This is the endometrial canal, and when I move the probe, when I angle the probe posteriorly, I get this echogenic, hypoechoic area with multiple internal areas, echogenic areas within it, that measures approximately. This is the area of solid mass, which is a fibroid with multiple internal calcifications. This white dense coarse echogenic areas giving posterior shadow. This is the cervix of the uterus, and thus suggestive of a fibroid. Though this finding is not a cause of infertility, cannot be a cause of infertility in this patient that we are studying today, because the endometrial canal is normal, clear, central. This is the endometrial canal. See, it's in early proliferative phase. Anterior myometrium is okay, posterior myometrium is doing okay. No focal lesion seen here, it's central, no clots, RPOCs, nothing is seen, it's clear. Endometrial canal is clear. This is the urinary bladder, this is the longitudinal view. And as I move the probe, now this is the full length of the uterus, showing you endometrial canal. And as I move the probe posteriorly, I see this is the endometrial canal. I have to move the probe posteriorly to get the solid echogenic area. So this area, remember that this area, I'm repeating it, is the solid ecogenic area, which is a fibroid with internal tiny calcifications, anterior half, and this is the cervix of this patient in transverse section. So it's separate from the endometrial canal, giving no mass effect on the central clear endometrial canal. This is the central clear endometrial canal. No mass effect is seen on that, on this. Now this is a subserosal fibroid. In fact, from the posterior, my upper segment of the posterior wall of the uterus, and we did see the endometrial. We did see the ovary, and the ovary is seen. This is the ovary with a dominant follicle in it, and right ovary is clearly visualized. So this is our case of the day. Thank you very much.